Well, hey everyone, it is the day after surgery. I was at the hospital at 5 a.m. for 7 o'clock surgery. Um, my nerves were just unbelievable. It was second guessing myself, all that kind of stuff. Um, but I was there, got in pretty quick. I only waited maybe 5 minutes outside of any kind of pre op stuff. Um, but got in and immediately started, getting prepped and whatnot. Um, got some sort of relaxer and uh, antibiotic right away through IV. Shaved the leg, prepping it, whatnot. I had the spinal block done, as well as the anesthesia put me out. Um, the doctor, he came in to see me in pre-op, is looked like he just woke up, and I don't blame him because it was like 5 a.m. So, um, but got wheeled in to the operating room. I remember that they strapped me down on this, like put me in like to a starfish. They strap down your legs in these special boots. Spread apart. My arms were out. They were strapped down as well. And I remember they did the spinal block. I felt that go in, but that was the last thing I remember. And then I was done. Um, Woke up in pretty bad pain. It was throbbing really bad. Um, enough to make you moan. I was like, oh, and they ended up having to give me some tramadol to get that to stop because there's the way I was in the bed, it was just putting pressure on the hip and it was hurting bad. Um, and I was in post op for about an hour. And then they wheeled me to like recovery. Um, yeah, that's really, really about it. They gave me allowed me to get something to eat and drink. The big thing was they want to make sure I can walk. So I had to do a little dog and pony show for them to walk, 20, 30 feet. Um, pick, go up a step, down a step. Um, I didn't have any nausea at that point, but I tell you what, when I was getting wheeled out, I started getting really nauseous, like bad, super bad, um, and just puked, just everywhere. As soon as I got out the door, I was really trying to hold it because I didn't. Um, I was just gonna wait till I got home, puke at home. Nope, puked all over the side of the car before I was getting in because I couldn't get a puke back fast enough. But all in all, that was basically it. I've got like 9 different medications. Um, the pain, other than immediately after and post op, was the worst. When I got home, I walked down the block a little bit, and it felt great. Everything felt amazing. There was some pain, but nothing crazy. Um, this morning is another story. This morning is a little intense, um, but not like a joint pain. the The pain is completely different. Um, it's it's expected. They cut your leg open. If you've seen a video, and I don't recommend watching a video before you do it, but it's very barbaric what they do. They If you watch the video, they cut the bone off. They got a drill. They got a hammer. So it's pretty intense, and it's suspected. Obviously, they cut your skin, all the way down so they can get to the bone. So it's expected that you're going to be sore. But today it's pretty intense. mostly soreness, which again, expected. But I also have this burning, like if you ever give yourself like a snake bite type of burn when you're a kid, you twist the arm in opposite directions. I get that. Feels like the skin is stretching, and that's what it feels like. I've got a little bit of a nerve pain, just a little bit of a nerve activity just above my knee. Nothing crazy, and then just soreness. Um, but it's pretty intense soreness. It's the worst soreness I've ever dealt with at any point in my life. So if you can imagine probably the worst soreness that you have ever had and multiply it by 5, that's probably what it's going to be. But again, you just have to remember your leg has just been cut, and it's probably about a 6-inch cut, at least on mine anyway. Um, so it's a big cut. All that tissue is going to be sore. It's going to hurt, of course. So it's nothing really to worry about. Um, Other than that, I feel great. I'm just obviously laying in bed. I get up once an hour to do a walk, 5-minute walk, so 2.5 minutes down the road, 2.5 minutes back. Um, but also once you get once you get out of bed and get it moving, the more you move, the looser it gets. So it's kind of like the just normal situation where if you have a sprained ankle, like immediately getting on it, it kind of hurts, but as soon as you start moving a little bit, kind of settles down a little bit as far as pain goes. So that's really it. Like I said, this is day 2. I had it early yesterday morning. Yesterday was the better of the 2 days, of course, because it felt so much better. Today it's just really sore. But I can walk. Hurts when I walk. Not like yesterday where it didn't really hurt when I walked, but today it hurts when I walk. But I expect that'll start to get better over the days. At least I hope. They give you a tramadol and oxycodone, so I alternate those every 3 hours, so that alleviates the pain. Um, Immediately after the surgery, I was exhausted. I fell asleep in the car on the way home. I was actually falling asleep while nurses were explaining or talking to me about whatever it was, and I was practically asleep. I was, had the zombie eyes going. Eyes were open, nobody was home. But I fell asleep in the car on the way home. That's how tired I was. Took a nap when I got home, of course, but I've been fine since then. Sleeping wasn't too bad. I've got a wedge that I put my legs up on for elevation. So I do that. When the pain meds aren't kicked in, it throbs a little bit, but it doesn't keep me awake. Because I went to sleep early, which is probably about 9 or 10. I woke up at like 12:30 to go to the bathroom, and then again around 3 to go to the bathroom. Actually, I think I took a pain med at that point too, because it was starting to get pretty bad. But at that point, I was practically ready for the day. I was kind of wide awake, so I watched TV until I just fell asleep again, and then I woke up at 7:30. So the sleeping at night, I've heard a lot of people be like, I can't sleep, so bad I can't sleep. I didn't really run into that. It was manageable. Although it didn't hurt more or less than what it normally would when I sleep. So I wake up with aching hips at night anyway, so whatever. It really wasn't so bad. But right now I'm just icing it, laying down, keeping my feet elevated. Everything feels good. They have you do bed exercises, which as long as I'm awake, I'm moving my legs anyway, so it's easy. I guess we'll see what happens in the coming days. as far as how the pain gets. I don't know if I'll make another video tomorrow, because if it's not any different than today, then, what's the point? But once I start noticing the pain be less, I'll do another video. So like today is Friday the 8th. So whenever it starts to lessen as far as pain goes, I'll make another one to kind of announce that. So that way you guys get a kind of an idea of, okay, for the X amount of days it's going to suck because it hurts and it's going to be sore. And then you can kind of get an idea of what happens with the pain whenever I make another video. But ultimately, not too bad. I got my walker, my cane, my shoe putter on her thingy. I've had a bowl right here just in case because I was nauseous yesterday. But I think I have the strap on my leg right now. I have the strap on my leg to help me get in and out. And I tell you what, if there's anything that burns the most, that's it, because it's stretching my skin so much. It's brutal. It's a huge burning pain, but it's not crazy, so don't worry about that too much. You're gonna feel it and like, holy cow, that hurts, but it's not a lingering pain after it stops pulling. Bandage, like I said, it's about 6 inches. I don't have any bleeding through. A lot of people might complain about bleeding through the bandage. I don't have any blood marks on it at all, so that's good. I'm usually not a huge bleeder anyway. Bruising, I'm not really sure. I haven't looked at it for myself. My wife said there's a little bit of bruising, but again, that's to be expected. You just had a huge amount of trauma on the lower half of your body. But I'm not a huge bruiser either, so I may or may not have a whole lot of bruising. But right now my leg is orange, which is I don't know what they did. They use an extraordinary amount of what's it called, iodine or whatever, and it's like down on my knee. It's all from the knee on up to my waist, or even onto my stomach a little bit. The amount of iodine is just insane. I literally look like a Cheeto. So yeah, other than that, the walks are fine. It's just a matter of loosening up the muscles, and if you loosen up the muscles, then it doesn't hurt so much. And that's the key. That's why I kind of keep my legs moving, iced, stuff like that. So far so good. I'm not experiencing anything that I wouldn't have expected. It sucks I can't really walk like I would have pre-operation, but once the pain goes away, then I should be able to, I hope. But yeah, we'll follow up with you guys in maybe a couple days and see how it goes, see how things are progressing, or whatever the case is. So until then, good luck.